The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Social media has been changing the world in ways we can't even imagine. Tonight, the Mayo Clinic Center for Social Media. You're watching Health Connections. Good evening. I'm Sean Riley. Social media has changed the world in ways that we couldn't even imagine 10 years ago. The sites like Facebook, Twitter, those types of sites have changed how people have interacted with each other in ways that are completely new and have evolved human culture. Tonight with me, we have Lee Acey, Director of the Mayo Clinic Center for Social Media. And the Mayo Clinic Center for Social Media is really an entirely new initiative intended to bring social media to healthcare. Lee, why don't you tell us a little bit about your center?
Yeah, well, tell a little bit starting with the history. I mean, in one sense, what you talked about, how these tools are really all new and they're changing culture. But there's really a lot of continuity with the way people have always communicated. It's just creating a global reach for the kind of face-to-face, word-of-mouth sort of communications that have been important since human speech was invented. So for 100 years at Mayo Clinic, our reputation's been made primarily by word of mouth, people having an experience at Mayo Clinic, going home to tell their family and friends about it. This is just the new way it happens in the 21st century, is that people go online and they're sharing their thoughts and their experiences. So for about 5 years, Mayo Clinic has had social media or new media kind of activities going on, from podcasting to our YouTube channel and Facebook and blogging and all that, sort of evolving over time. And we've just come to the point where we've said we need to take this to the next level, to the next step of really infusing social media throughout Mayo Clinic in terms of how we actually operate, our collaboration among employees, connecting our researchers with researchers around the world, and then also making even more resources available for patients, creating patient support communities. So that's the first part, is having Mayo Clinic make the maximum use of social media, these revolutionary tools. But secondly, to help the healthcare industry, to help the healthcare system and others, not-for-profits and other groups that are interested in promoting health and using social media tools. There's been a lot of fear, a lot of misunderstanding of what some of these tools are, and just, because of not understanding, healthcare has lagged behind in adopting them. And so what we're trying to do through the Center for Social Media is help Mayo Clinic to be the best it can be in using these tools, but then also lead the way with other healthcare organizations to say, to demonstrate the benefits of these for the patients, and to help them sort of step-by-step work through some of their concerns, whether it's IT or privacy or viruses, legal, other questions, and employee productivity, whatever the questions might be, to help provide the answers so that advocates within organizations who want to apply social media have the resources to make the arguments internally about why this is beneficial.
Well, for everyone watching us, I want to point out tonight that we have posted this out on Twitter, and we have about 250 questions, a little over 250 questions now, that have been coming in all around the Center for Social Media.
So this is like 12 seconds each, I guess, right?
Yeah, exactly. So
we'll get to what we can do.
Yeah, so we will try and hit a few of these. But as you were talking about the evolution of people's communication, 100 years ago, it was one-on-one, just like this, and the ideas spread one person at a time. Today, I can put my idea out and 1,000 people can all read it in 1 second flat and go from there.
Right.
What does that bring to a patient in today's world? How does that communication help today with people with whatever diseases they have?
Okay. Well, I mean, it used to be, I mean, if you're talking about dealing with stories or dealing with conditions in depth, for a story to have broad reach, it had to be important enough that somebody who owned a TV transmitter or a printing press was willing to devote their resources to publishing that information or broadcasting that information. And so it was very limited to the mass audiences. It meant that, you know, conditions had to affect an awful lot of people or be really, you know, weirdly compelling to attract an audience to pay for advertisers, you know, other than, you know, on public TV kind of stations. And so, you know, it really limited the scope of what kind of things got discussed, and it made, you know, so when we, for instance, at Mayo Clinic are doing stories that are aimed at the mass media, I mean, they tend to have to be shorter. They have to be just enough to be interesting to the broader audience. The power of some of these tools is that, you know, you can do a YouTube video that's 10 minutes on a topic, and it doesn't have to appeal to everybody. It just appeals to the people who have that particular disease or know somebody who does. And you're able to really provide in-depth information that previously would have not been possible to spread worldwide, and essentially for free. I mean, you put a video on YouTube, a 10-minute video, and the people who are interested in it are going to find it because of Google, or they're going to get it passed along because they're part of a patient support group online, and the people to whom it matters are going to be able to see it. Or patients who want to share their stories, you know, can do that. I mean, what it really means is that instead of having to have a printing press or a TV transmitter, anybody can do it. I mean, with a blog that they can start in 30 seconds on WordPress.com or Blogger, or on YouTube, you know, an account. If they just got a simple video camera, they can create their own TV channel, so to speak, which is really amazing.
So how do you go against the misinformation? How do you battle that misinformation that's out there? One of the biggest problems people always cite, and one of the big recurring themes with questions, is that if it has Mayo Clinic's logo on it, people are going to trust it. But if it's got the patient's perspective added to it, the patient may be trying to be completely honest, but maybe completely wrong. How do you battle things like that?
Well, my friend Andy Cernovitz has a saying that maybe applies in this one. He says the solution to pollution is dilution. You know, that you know, there can be negative comments or other kinds of, you know, misinformation out there, but the solution is to provide the real trustworthy kind of information. And actually, we have a great example of this with one of our patients, a story that I was made aware of late last year. A young lady from, 14-year-old girl from Southern California woke up after a day at Disneyland, was throwing up 10 to 12 times a day for about 6 months, and went to see local children's hospitals, local providers, wasn't getting an answer for it. Her mom was Googling late one night and came across a blog by a patient, okay, another young girl who said she had symptoms that were very much like this young girl Haley's. And so the mom said, wow, this sounds like what Haley might have. But the patient, actually, the blogger patient, had linked to a video mentioning Dr. Phil Fisher, a Mayo Clinic expert in POTS syndrome, postural orthostatic tachycardia syndrome, which it turns out is what Haley, this young girl who was vomiting 10 to 12 times a day, had. When Haley's mom went to her local doctor, the local doctor said, well, first of all, she said, sounds like Haley might have POTS. Do you think that's what it could be? And the doctor said, nah, that's just a throwaway diagnosis, isn't even a real thing. The fact that Dr. Fisher had a 5-minute YouTube video talking about his research in POTS gave Haley's mom courage, okay, to say, you know, this is Mayo Clinic is putting this out. It's got to be, you know, trustworthy, and made her come from Lake Arrowhead, California, to Rochester, Minnesota, to get eventually confirmation of the diagnosis and treatment of POTS. So Haley now is back in school doing well, and if it hadn't been for Dr. Fisher making that video available, maybe she would have buckled under. Maybe Haley's mom would have buckled under to the doctor back home saying, that's not even a real thing, and Haley wouldn't have gotten the help she needed. So that's where we sort of see this as almost a moral responsibility, that given that there is going to be misinformation out there, you can't solve that. What you can say is we're going to do our part to provide resources and material that is trustworthy. And we really believe that over time, the links that people and the tweets and other kind of, the good information is going to rise to the top, is going to be more frequently cited, and it's going to help the patients get the information they need.
Yeah. That's a great example of patient empowerment, and that's one of the core principles of social media in healthcare. Mm-hmm. Do you see that the Mayo Clinic Center for Innovation or Mayo Clinic Center for Social Media together can add to that? Are there other ways that you can empower the patient through e-health and social media combined?
Yeah, I mean, I think people sometimes ask me what keeps you up at night, and it's certainly not worrying about some terrible thing happening. It's looking at all the opportunities that are there. I mean, it's what can we take advantage of next in the good sense? How can we apply some of these tools to benefit patients? And things like online patient support groups have been happening for a long time, and often they haven't had medical professionals involved in them. We'd like to do experiments with that and looking at new ways of getting helpful information to maybe help manage populations of patients with chronic diseases that need to have. I mean, they can learn a lot from each other. That's part of the patient empowerment, but also bringing in the medical expertise, where appropriate, and finding out ways to make that work. I think they're just these tools are the most revolutionary. I mean, it's the biggest development in communications since the Gutenberg printing press, because the Gutenberg printing press made mass literacy possible. Mm-hmm. Made it possible for average people to be able to read. Mm-hmm. Back then, before the 1500s, only scribes could read. Now, almost everybody can read. We have almost universal literacy. The new tools make universal publishing possible. So not just literacy, but the ability for people to make connections and express themselves.
So as you talk about support groups, one of the groups that existed previous to the center, it was a diabetes group that is handled by one of the Mayo Clinic Health System sites. Mm-hmm. And then that group sits in Facebook and mm-hmm. Bringing people with diabetes together. How are physicians going to manage the future of healthcare like this? How is it that they're going to be able to, one, get the government and payers on the side of actually reimbursing for services like this, which mm-hmm. currently doesn't happen today, but two is how do you see a single physician or a diabetes expert maybe handling large social media groups, or how do you see physicians interacting?
I think there's possibilities with that, and I think what it's going to take is physician champions who say, we want to make this work. We want to figure out a way to make this work, and we want to prove that it's going to be helpful. And it may mean at first that they have to, say, I'm just committed to this, and I don't know how the reimbursement works, but we're gonna do it because it's the right thing to do, and then we'll do the studies to show that it actually helps, that it really works. So one of the things that we want to do with the Center for Social Media is rigorous, studies, comparing one population that has the intervention with the social tools and one that doesn't, that we're able to publish in the medical journals, the peer-reviewed journals, the clinical practice kind of journals to be able to make the case, to prove the benefit. And as I think that as we're able to show that, the payers and the others will come around on it.
How about from the patient side? What about privacy in this case, where a lot of groups like this are pretty public? If you go on to Facebook, for instance, mm-hmm. You could falsify your name, but the likelihood is if you continue to use Facebook and you have friends, people are going to figure out who you are. What are some of the aspects of privacy in social media? It's really created a place where people can come together, but it's also created a place where there is no more privacy in some cases.
Well, I mean, I think to some extent, patients are going to need to make their own judgments in terms of what value community is to them versus privacy. And there's some ways that we can work around that with some of these groups, where sometimes you'll have a screen name or some kind of thing that like there are groups like Patients Like Me, where you sign up and you use a pseudonym instead of your real name. I think we need to work through some of those issues. I think one of the things we're hoping to do, or we're planning to develop for the Center for Social Media, is a networking platform that would be private, secure, not on Facebook. I mean, right now we're doing things in secret Facebook groups as kind of a workaround or kind of proof of concept that this kind of thing can work. But by having a more customized solution, so that patients will need to go into it fully aware of the fact that they will be meeting other people like them, and they may or may not be using their real names. I mean, those are some of the things we need to work through. But we definitely need to have disclosure with the patients who are involved in this, that when you're talking out in public about a condition, other people are going to know that you have the condition. So, but part of empowerment, is to be able to say, I know that I may be giving up some of that space voluntarily. I mean, you don't want anybody to take it from you, but I may be divulging on my own that I have this, but it's for the greater good for me of being able to connect with other patients like me. I think that's the point.
I think the other beauty of this for social media, since it's this ever-evolving thing, and all of this new technology is just coming out for everywhere, that there's all sorts of new uses we haven't figured out yet, and ways maybe to handle patients like that. One of the studies that we've seen is for anonymity using Second Life, where Second Life used to be strictly a video game, and you go in and do your virtual world. Right. And now where we've got things like addiction groups and chemical dependency groups that can meet in Second Life, something that there was no intention of using Second Life for that type of thing to begin with. Do you see a lot of these other types of tools evolving that same way? Are there other tools that you see that we really have a need for that haven't been invented yet?
Well, I think I see, obviously there will be lots more invention of tools, because Facebook didn't exist 6 years ago, and YouTube didn't exist a little over 5 years ago. So, yeah, there will be new platforms. I think the more interesting thing is how people can take some of the basic tools that are out there now, things like Facebook, like YouTube, like blogs, like Twitter, and combine them in interesting ways to accomplish what they need to do. I mean, one example of something we're doing at Mayo Clinic is syndicating a weekly radio program, that was previously just in Rochester on KROC radio on Saturday mornings. But Dr. Tom Shives is an orthopedic surgeon, has hosted that program for 19 or 20 years. And it was previously only heard locally. We looked at syndicating it through some of the traditional means, like through one of the radio networks, and it was going to cost something like $20,000 a month to do that. We decided, let's look at how can we do this through social media instead, and so we're syndicating it through a blog. We're posting the topic up on the Monday morning and tweeting it, spreading it out through Twitter, what the topic is for the week. People can listen live over the web on Saturday mornings if they're outside of Rochester. Otherwise, they can tweet their questions, and we reply via Twitter, but also answer on the air. But then the following week, that recorded program is made available to radio stations, actually internationally. We've got one in Canada, and but we've got several others throughout the United States, about 20 stations now. And the cost of that is really low, a couple $100 a year in terms of the actual hardware, software kind of costs. And it's really kind of amazing that these tools combining in a blog, Twitter, and podcasting, is enabling us to reach many times the patients that we could previously. One example of this is on one Saturday morning, we had questions tweeted from Australia, Indonesia, and North Carolina. And that just, considering that a little over a year ago it was only Byron and Rochester and Stewartville, that's really neat.
Yeah, yeah. So as you expand this entire project, and all the new technologies and everything comes along, the one constant is that the people who use it are going to need internet access. What will the center look at for helping those people who are the underprivileged folks who don't have either the money to be able to get access, or maybe somebody like me who lives in the wrong place and can't get the best internet access out there? What are some of those options?
Yeah, I mean, I'm not sure that we're going to be able to solve the systemic kind of issues. I think what you're seeing in some of the third world countries is that they're leapfrogging the wired internet to the wireless internet. They just see a lot more use of mobile devices, like the one that you're holding in your hand right now, that there'll be things like that. I mean, I think that's a real issue. I think it's one that probably is above my pay grade in terms of being able to solve. I think some of the looking at applications that will be supported by mobile devices, I think will be an important feature. But I mean, really basic internet connectivity is something that I think needs to be a societal priority. And then when you have that, we'll be able to to apply social media in health and in other areas.
So what has been the patient response to this new program? I mean, we've seen, I've seen on Twitter and in the social media world, a huge response from healthcare organizations, very excited about this. What has been the response from patients?
I think what I would just say that the response to our social media platforms for Mayo Clinic over the last 3-4 years has been tremendous. I mean, we're at something approaching 80,000 followers, I think, on Twitter, and we've had 2.5 million or so views on YouTube.
Slightly more than me.
Yeah, there we go.
Just barely.
There we go.
Yeah.
And lots of what used to be called fans on Facebook that people. I mean, for 100 years, word of mouth, people have wanted to tell their stories when they get home about what their experience is like. And so we've seen, strong adoption there, strong interaction there. I think, I don't know how much our Center for Social Media has made a dent in the consciousness of the general public. I think they're thinking more about the economy and the BP oil rig or whatever, kind of things have been going on. But I think the fact that we're seeing healthcare providers, other not-for-profit organizations in the health space eagerly embracing this will help. Yeah, we'll bring lots more people into the discussion.
With the providers embracing it and these other organizations, do you see that they're going to need to really go down a new training path for doctors and nurses in the future? And is there, because it's not something that's really ever had happened before.
Right.
I mean, we've kind of changed. In 1995, I would go into a doctor and say, "Hey, doc, what's wrong with me?" In 2005, I'd walk in and say, "Hey, doc, I think this is what's wrong with me," because I looked it up on mayoclinic.com or webmd.com. And today I come in and go, "Here, doc, here's what I have. Give me this med," because I can find these resources everywhere. Do you think that's really going to change for physicians and nurses?
I think one of the things we're planning to do with the Center for Social Media is developing more in-depth curriculum and training in using tools like this, so they will be able to engage, and that they'll be able to do it with confidence, knowing that they're not going to be, violating HIPAA or otherwise putting themselves in a bad position. So at Mayo Clinic, we have about 56,000 employees and students, and that's part of what, when you're saying what's new with the Center for Social Media, where previously our work has been more on the public relations kind of patient information content, spreading the news about Mayo Clinic research. We're really saying we want to take the staffing that we have for the center and do that in-depth training with our staff, and then beyond that, make some of those same resources available to other healthcare organizations. So it's really a case of we'll develop a curriculum for health professionals and others involved in healthcare, and then once we've developed that, through the center being able to make it available to other organizations will accelerate, I think, the adoption, because I think people will say, well, this is the curriculum Mayo Clinic is using to train its staff. Maybe we can adapt it for us, or maybe we can maybe it's good enough we can just use that. And otherwise, people interested in healthcare as professionals, just as individuals, can say, hey, that's a good resource, and this helps me, get up to speed.
So with Mayo leading the way here on a national basis, do you see other organizations following suit, or do you think other organizations will partner with Mayo to create a larger, maybe a regional healthcare entity or in this space? Or?
Yeah, I mean, I think what we're planning to do, we have the Center for Social Media. We're also looking to develop a network. That it will be a network of providers and, again, other health-related organizations that want to use social media to improve human health and to improve healthcare. And so there will be, this is something we're working on developing right now, kind of a membership-based network where other organizations who want to be part of this would be able to join in, have access to the training materials, and also to be able to have discussions about and learn from each other. We look forward to learning from them too, because we've just maybe been a little further down the road in this, but definitely as we get more people with more experience, there'll be lots we can learn too. Great.
Well, it's an amazing topic, and I'm glad to have Mayo Clinic leading the way here for social media.
Well,
it's certainly going to be a huge game changer when it comes to healthcare in the future. So
I think it certainly will, and appreciate what you've been doing too, in terms of, there's lots of things going on where maybe there hasn't been as much media attention or whatever, but I the work that you're doing with the health system is great too.
To cut you off, but thank you, Lee.
Okay, thanks.
This has been Sean Riley with Health Connections. Thank you very much.